Ladies and gentlemen, Nursing and Medical Academy brings you a short presentation on sickle cell disease. This is a platform where we make understanding of conditions very simple by demystifying medical mysteries. The word sickle is coming from this tool you can see. This tool is actually used or was used by ancient people. Some of us also use this in our villages and then in our farms for harvesting. So the shape aspect of it, because the sickle or the blood forms or the shape of it looks like this tool, that is why it is called sickle cell. Sickle cell. So this is the tool. Now, when we say sickle cell disease, what is it at all? What is sickle cell disease? It is a hemolytic disorder that results from inheritance of sickle cell hemoglobin gene. And this gene is usually inherited or must always be inherited from both mother and father, and then to make it a disease. So the person will have hemoglobin SS. Normally, you have what we call adult hemoglobin. That is hemoglobin A. So one from mom, one from dad. So AA, and that you are good to go. Then we know when you are born, you have what we call the fetal hemoglobin. That is hemoglobin F. As you are growing, the adult hemoglobin will substitute the fetal hemoglobin. Hence, you must get hemoglobin AA. There are other types of hemoglobins we will not talk about in this short presentation. But the normal thing as an adult is hemoglobin AA. That is adult hemoglobin. What happens during sickle cell disease? What causes sickle cell disease at all? Have you asked yourself this? The cause of sickle cell disease is biochemical in nature. Why am I saying this? There are important about 20 amino acids in the body. Very, very important for life. Two among them, we have valine and glutamic acid. Now, when you take the hemoglobin, which is found within the red blood cells, the hemoglobin is actually having two beta chains and two alpha chains. Now, in sickle cell disease, the alpha chains are not actually the cause, but the beta chains. What happens to the beta chains? When you pick the hemoglobin, glutamic acid is usually attached at the beta chain at the sieve position. Glutamic acid is usually attached there. But unfortunately, when you have a situation where this glutamic acid is missing at the beta chain, the sieve position, and valine is found there, that is what leads to what? Sickle cell disease. So the normal thing should be glutamic acid should be attached at the beta side chain of the hemoglobin at where? The sieve position. But when it is displaced biochemically and then valine attached there, that is what causes sickle cell disease. The reason is that valine has different properties from what? Glutamic acid. For instance, valine is non-polar, and so it is hydrophobic. It means it fears water, unquote. But glutamic acid, it is polar, it is negatively charged, and it is hydrophilic. It is water loving. And we know that anything that is water loving will always encourage what? Solubility, or it is more soluble. So glutamic acid aids in what? Solubility. That is why at all times hemoglobin A remains dissolved in the cytoplasm of the red blood cells, and that prevents aggregation of the red blood cells. Are you getting it? Because it is glutamic acid which is found on the sieve position on the beta chain of the hemoglobin, it ensures that all the time hemoglobin A remains dissolved in the cytoplasm of the red blood cells. So it doesn't become sickle, like they don't accumulate to form polymerization where it will lead to what? Sickle shape. But when you have valine taking place of the glutamine, what happens is that this hemoglobin S will lead to what? It will prevent dissolution, or the hemoglobin will not dissolve in the cytoplasm of the red blood cells. So making it what? More stiffer or rigid as compared to what? That of hemoglobin A. Ladies and gentlemen, this is the scientific basis of sickle cell disease. Now, what happens again is that the lifespan of sickle cell, the red blood cell, is now reduced from 120 days to what? 10 to 20 days. So the cells will break down more as against their production. So you see, demand and supply is compromised. Now, as you have more cells breaking down, it means you are releasing what? More bilirubin into the blood. So don't be surprised that sickle cell patient under crisis, you see them manifesting what? Jaundice. Evidence on the sclera. Yes. And then the sickle cell disease, the difference between sickle cell disease and sickle cell trait or carrier. In sickle cell disease, it means you have the hemoglobin S, both from parents are hemoglobin S. So you have one from mom, one from father. That is why when both of you are carriers, you are not advised to marry, because you have 50%, the other one has 50%. So when you give your 50%, another one gives 50%, you are producing an offspring that will get 100%. Though all the children may not, some may skip this, fine, but it is not advisable. A majority of them will get sickle cell disease. But when one is a carrier and the other one is totally negative, then you can go ahead and do what? Marry, because the children you are going to produce, most likely somebody can just be a carrier, and in that case, that person too must ensure he or she marries someone that is also negative, and then the generation will be free. Fine. So you can do tests to ensure that you know your status before marriage, but sometimes love become or overpowers medicine. So you can do HB electrophoresis to establish this. So you can have a career and then you can have the disease. They are two different things. Now look at the normal and abnormal cell. You see the normal red blood cell shape? The normal is actually round, pliable, biconcave shape. But with the sickle one, it becomes, sickle or crescent, has its crescent shape. It loses the pliable nature. It will be more rigid. And that is so abnormal. You can see the difference. So look at the sickle cell, the movement of it. When another one comes to cross it, another one also comes to cross. So they are building up in the microcirculation, and that leads to what? Vaso-occlusive crisis. They occlude, that is, they block. Fine. Signs and symptoms of sickle cell disease. So, or you can have anemia and jaundice, like I explained earlier. You have, HB of 7 to 10 gram per, is it deciliter? Yes. Mostly that is where their values form. 7 to 10 gram per deciliter. And then jaundice may also be noted. Bone marrow expansion in childhood, leading to enlarged bones of the face and the scalp. This is a compensatory, mechanism to offset the anemia in children. So the bone marrow tries to expand, because of its electropoietic function, to ensure that enough is produced to offset the anemia. Therefore, the child will grow, and mostly when you assess them at the pediatric ward, you see that these children, they have large head in proportion. Fine. You have when you have anemia, you can have tachycardia, cardiac murmurs, cardiomegaly, and heart failures. So some of these things too, especially in the case of tachycardia, is just a mechanism, compensatory mechanism in the case of anemia to meet metabolic demands. Splenic, liver, and pulmonic sequestration. With those, you have the blood cells, now the sickle blood accumulating in this organ. So you have splenic sequestration, liver sequestration, and then pulmonic sequestration. And this can lead to severe complications. And even in the case of pulmonic sequestration, it leads to death. Fine. We have infection. Most often, you have infection like pneumonia and osteomyelitis. Why will they have this kind of infection? The reason is the low oxygen level and blood supply, will try to favor what we know as the Staphylococcus aureus and Salmonella species, which are implicated in osteomyelitis, and that of Haemophilus influenza and Chlamydia pneumoniae. Those ones are also implicated in pneumonia. And the reason is that we have functional asplenia. That is, you have the spleen present all right anatomically, but functionally, that is physiologically, it is not able to provide its function. What function does it provide? It provides an important function when it comes to immunity. That is the spleen. So because there is no proper blood flow, there is ischemia in the spleen, there is sequestration in the spleen, it is not able to filter this blood well, it is not able to produce or give its immune function that will be able to hinder the Staphylococcus, Salmonella species, Haemophilus influenza, Chlamydia pneumoniae, and other microorganisms. Therefore, the patient is predisposed to pneumonia, osteomyelitis, and other infections. And unfortunately, when this infection happens again, they even try to worsen the whole situation. So you can have some complications like sickle cell crisis. Sickle cell crisis. Now, this sickle cell crisis is a very serious issue, and I think going ahead we'll talk about it. We have infection, we have stroke, we have renal failure, we have heart failure, priapism, that is constant or prolonged pineal erection, acute chest syndrome, and pulmonary hypertension. Effect of low oxygen tension. When there is low oxygen tension under normal hemoglobin A, the hemoglobin is not affected, so the shape of the red blood cell too is not affected when you have low oxygen. Unfortunately, the hemoglobin S is very sensitive to low oxygen tension. So once there is low oxygen, more of them will start forming what? Sickle cells. They become sickle in nature, they become stiff or rigid, and then the whole crisis will start. So anything that will lead to reduced oxygen supply or increased oxygen demand will trigger the crisis. Yes. So what happens is that when this happens and there is low oxygen, there are free radicals that are generated. When these free radicals are generated, what happens is when blood is supplied, these free radicals get access to the blood vessels endothelium and they destroy the endothelium again. Now, when the endothelium is destroyed, what happens is that the blood can get attached to them and undergo polymerization, like they start aggregate, they attach to one another and become large clots. And this can now go into the brain or other organs like the kidney, the spleen, and then cause obstruction there. And that can lead to what? Organ failures. Yes. So sickle cell crisis, we have, like I just explained, that is what will happen in sickle cell crisis. We have painful vaso-occlusive crisis. That is the most common thing nurses we see among our patients. So there is occlusion because of this clots that form That will lead to occlusion. Aplastic crisis. With aplastic crisis, what happens is that there is an implicated virus known as the B19 parvovirus. This parvovirus, when it sets in, it stops the production of red blood cells. So there is a significant reduction in the HB of the patient, and that will lead to low blood at the HB level. And then we have sequestration crisis, like in the liver, splenic sequestration, and then pulmonary sequestration. Fine. So precipitating factors: low oxygen level. In the case of high altitude respiratory infection like pneumonia, when you have something like asthma attack, sleep apnea, and strenuous exercise, all of these will lead to what? A low oxygen levels. And then when you have dehydration, in the case of vomiting, diarrhea, and other things, can trigger this infection. When you have infection, like I said, the parvo B19 virus like this, it can make sure it will stop production of what? Red blood cells. And when that happens, you have low HB. And when low HB happens, the crisis will set in. You have cold temperatures. Cold temperatures will favor vasoconstriction. When vasoconstriction, vessels are constricted, what happens? Occlusion in the microcirculation. So most often, this is what brings most of our patients to the hospitals. Cold temperatures, and then infection. Emotional stress. In this case, emotional stress will trigger the release of catecholamines like norepinephrine, and this will have systemic vasoconstriction, and that will reduce or have effect on blood flow. And then you have strenuous activities, like I mentioned, will increase the demand, and the supply too is not there. So if the demand is increased and it's not corresponding with the supply, what happens is that it will trigger the attack. Alcohol actually is known to cause dehydration, and some drugs like cocaine also has a systemic vasoconstriction, and then it will impede blood flow. Anesthesia and surgery, and that is why even the champion surgeon will not rush a pregnant woman with sickle cell crisis to the theater for CS, because you may lose the patient in the theater. Because anesthesia and surgery will try to induce more stress on the patient, and at the end of the day, you may lose the patient. Pregnancy, acidosis. Pregnancy will call for more demand, and we know that is a factor. In acidosis, when you have low pH, blood pH, it will try to favor polymerization, and then the cells will aggregate, at the end of the day, impede circulation as well. Management, we have fluid therapy, very important. So you give patient fluid so that it can help to reduce the hematocrit level or the viscosity of this blood, so that it can flow easily. Direct pain management, you use NSAIDs. NSAIDs can be used, but use them with caution, because sometimes the crisis alone or sickle cell has effect on some important organs. So if you go ahead to load this patient more with this NSAIDs, at the end of the day, you end up worsening the patient's situation. Therefore, it is advisable to take caution when giving this, especially in renal dysfunction. You can compromise the function of the kidneys. So we can have the NSAIDs also play key important role, as they also help to decrease platelet adhesion. You can use a champion drug like aspirin, fine. It will help in that. It will help platelets decrease platelet aggregation, and then also reduce inflammation, fine. And then you can use warm therapy, because we know cold therapy or cold aids in vasoconstriction. Warm will also cause what? Vasodilation, so that blood can flow well. Or when patient is on admission, provide them with what? Warmth, by ensuring proper covering. That will help. Then transfusion mostly is also used for the patient to increase the volume of blood, as well as the oxygen carrying capacity will be increased. We have some drugs like arginine. Arginine has anti-sickling properties and enhances availability of nitric oxide, which is a vasodilator. In fact, that will help to decrease pulmonary artery pressure. But then it has other side effects that some prescribers may not like to use. We also have another drug like the hydroxyurea. It's a chemotherapy agent that is used to increase fetal hemoglobin instead of the adult hemoglobin, which has been replaced by the hemoglobin S. So this fetal hemoglobin can help to carry more oxygen for the necessary tissues and organs. So that is the rationale for hydroxyurea, but it also has some effects. Then key nursing intervention, managing pain, very important. Preventing and managing infection, very important. Education to empower your patient. Monitoring and managing potential complications. Prapism, which will lead to what? Impotence and chronic pain and substance abuse. You have to nurse patients on this. Now, prapism. When prapism occurs, you ensure the patient empties the bladder at the onset of the attack. Encourage patient to take warm bath, and if after 3 hours this doesn't stop, you have to start IV therapy. And then intracavernosal aspiration, where you aspirate blood from the penis. Why is impotence implicated in prapism? This is because vascular thrombosis in multiple episodes will lead to what? Impotence. Ladies and gentlemen, this is where I bring this short presentation to, and subsequent ones will be specific on aspect of sickle cell gene therapy. Thank you. Enjoy this. Don't hesitate to link me with any clarification or addition through stewardinokwabena@gmail.com. Enjoy your moment.